In the heart of Colombo stands a beacon of medical excellence and history, the Faculty of Medicine, University of Colombo. Established in 1870, it is the oldest medical faculty in Sri Lanka, nurturing generations of doctors and shaping the nation's healthcare journey. Among its most esteemed departments is the Department of Obstetrics and Gynecology, founded in 1933 by the visionary Dr. G.A.W. Wickramasuriya, a trailblazer in maternal and women's health. Dr. Wickramasuriya was appointed the first professor of obstetrics and gynecology in 1936. In 1943, he was succeeded by Professor Sir Nicholas Atagai, whose dynamic leadership expanded the department's academic and clinical horizons. Under his stewardship, the department flourished, serving the nation through Ward 39 at the General Hospital Colombo, now the National Hospital of Sri Lanka, and Ward 15 at the De Soysa Maternity Hospital. Over the decades, the department has continued to evolve, guided by distinguished leaders such as Professor D.A. Ranasinghe, Professor D.E. Gunathalake, Professor S.H.P. Naniakara, Professor H.R. Senavaratna, Professor C. Randaniya, Professor H.M. Senanayaka, Professor A. Kaluaregchi, and today, under the leadership of Professor Chandana Jayasundara. To preserve and celebrate this remarkable legacy, the department now envisions a museum, an exclusive collection of rare obstetric and gynecological equipment and valuable archival materials. These exhibits will not only reflect the evolution of clinical practice and education in the department, but also chart the broader development of the field of obstetrics and gynecology itself, both locally and globally. This museum will be a quiet yet powerful space, honoring the tools, texts, and milestones that shape the care of women across generations. Among the rare and sobering artifacts to be featured is the cranioclast, a destructive obstetric instrument used in an era before safe surgical alternatives were widely available. The cranioclast was used during obstructed labor to perforate and crush the fetal skull in order to facilitate delivery. Though it may seem harrowing today, such interventions were often the only option available to save the mother's life in an era without safe cesarean sections or effective anesthesia. Destructive instruments like this, though now long obsolete, reflect the desperate choices faced by practitioners of the past. The use declined sharply in the 20th century with the rise of safer techniques, such as forceps-assisted delivery, vacuum extraction, and cesarean section. But behind each of these tools lies not only science, but tragedy. In 1817, Princess Charlotte, the only daughter of King George IV, endured over 2 days of unassisted labor. Her obstetrician, Sir Richard Croft, refused to intervene, even with forceps at hand. The child was stillborn, and the exhausted mother died the next morning. Racked with guilt and public criticism, Croft took his own life. Another artifact that carries with it a long and layered story is the Schimmelbusch mask. Introduced in the late 19th century, this simple-looking wire frame was a key innovation in the early days of surgical anesthesia. Gauze was stretched over the frame and soaked with ether or chloroform, allowing doctors to control the amount of vapor inhaled by the patient. Though crude by today's standards, it marked a turning point, offering patients, for the first time, a more humane surgical experience. The mask not only made longer and more complex procedures possible, but also greatly reduced the fear and suffering once associated with surgery. We've taken a closer look at a few of the key instruments in this museum, but not every item in the collection will be discussed in detail. Still, each one holds significance. These are tools that reflect the evolution of obstetric and gynecological practice over decades, sometimes even centuries. From variations of forceps and retractors to diagnostic and surgical instruments, each item was designed to meet the clinical challenges of its time. Some represent milestones in medical innovation, while others serve as reminders of the limitations and risks once faced by both practitioners and patients. As we now move through this visual overview of the collection, it's important to recognize the value of preserving these instruments, not merely as historical curiosities, but as educational assets. For medical students, they provide a practical link between theory and history. For postgraduate trainees, they offer insight into the progression of surgical techniques and the roots of today's standards in care. This museum will serve not only as a space for remembrance, but also as a platform for learning and reflection. In doing so, it helps ensure that the history of our specialty continues to inform its future.